Okay, hello, and last video that I made was on imaging and various instruments used for imaging. So this one is about interpretation. So has seen in this Grace Anatomy for students. Uh, so it's a little bit tricky to interpret uh, images, so I prefer to skip this one. Okay, so it's regarding the safety of the images. So exposure of the body to various imaging instruments and also the rays that emit from those instruments. This is regarding the safety guidelines. So, regarding the body system, so skeletal system as such. Okay, this is in depth. This is just a surface view of the body systems, not an in-depth one. So skeletal systems can be classified as appendicular and axial. So as can be seen in the image, you have axial skeleton and appendicular skeleton. So the uh, dark colored shades are appendicular skeleton, and almost this skull, ribs, and vertebral column, manubrium, sternum, and the sacrum come under axial one. So uh, this shows what this axial and appendicular skeleton is. Uh, and so the cartilage, you have various types of cartilage. Uh, hyaline cartilage, yeah, the elastic cartilage, and fibro cartilage. So the examples would be like the elastic cartilage, which is uh, externally, so which is almost like a flexible one, and fibrocartilage, so intervertebral disc. So intervertebral disc is prone to various. It can be bent and molded, both molded uh, to the as required by a human. So okay, no, not many people can do that. So hyaline articular surfaces of so the so the bones based on on the structure of the bones are classified into two types: compact and spongy. So mainly compact and spongy, and also the bones are classified into long bones, uh, as long bones like tubular bones, humerus in the upper limb, and femur in the lower limb. And so humerus would be like the upper arm, and the femur would be like the thigh. And short bones are cuboidal bones of the wrist and ankle, and flat bones of two compact bones, plates separated by spongy bone, like skull. Irregular bones, uh, irregular bones with various shape. Bones of the face and the small bones are round or oval bones with a developing tendon. So on the other hand, okay, that's a good one. Like on the other hand, the periosteum is supplied with numerous sensory nerve fibers and is very sensitive to any type of uh, injury. So what periosteum is? So even periosteum. So periosteum hardens layer of vascular connective tissue enveloping the bone except at the surface of the joints. Okay, that's a good one. Uh, okay. Uh, so there are some clinical cases discussed here. So determination of the skeletal age. So uh, from okay, the ossification of the bones does not happen in the early age. So these are the early images from early developmental images of a human. So ossification happens only in the later ages. So which is like this. Our the last two images ossification happens, and okay. So these are the developmental radiographs of progressive ossification of carpal bones. Okay, so so some disease states such as malnutrition and hypothyroidism, the bony maturity may be slow. So if the skeletal bone age is significantly reduced from the patient's true age, the treatment may be required. So another one is bone marrow transplant. So this image shows yellow marrow in the femoral head, and red marrow in the bone body of the vertebral vet, lumbar vertebrae. And so this one is a T1 weighted image in the coronal plane demonstrating the relatively high signal intensity returned from ephemeral heads and proximal femoral necks consistent with yellow marrow. So in this young patient, the vertebral bodies return in an intermediate dark signal that represents red marrow. There is relatively little fat in this vertebrae and hence a lower signal return. So okay, so vertebral column. So vertebral column, the development is there's some unusual thing. And okay, so the bone marrow transplants. So this is a bone marrow transplant, and another one is bone fracture. So this one shows fracture. Okay, this one shows a green stick fracture of ulna. So ulna would be the lower limb. So lower limb radius. Okay, you can visualize the radius and radial epiphysis. So ulna. Okay. Uh, Radiograph. Okay. Later we showing the green stick fracture of the distal uh, radius and distal ulna. So okay, the fracture is called a green stick fracture. Okay, the fracture. Okay, this fracture is called a green stick fracture, and there are a few more. One, so avascular necrosis. Avascular necrosis. This image is a good one. Avascular necrosis. So wasting of gluteal muscle. So gluteal muscle, it's from the thigh. So you can this is a femur, and this bladder, urinary bladder, avascular necrosis, normal left hip. So okay, this the image of the hip joints demonstrating the loss of height of the right femoral head with juxta-articular bone sclerosis and subchondral cyst formation secondary to avascular necrosis. So there is a significant wasting of the uh, muscles supporting the hip, which is secondary to disuse and pain. So necrosis. So wasting of muscles happens here, and osteoporosis. So that's another one. Osteoporosis. So this one shows. Okay, then this is an enlarged one. So this is a vertebral column. So wedge fracture. So let me see. Radiograph of the lumbar region of the vertebral column demonstrating a wedge fracture of the L1 vertebrae. So L1. Okay, this condition is typically seen in patients with osteoporosis. Okay, then there's another image. So there's another image. Okay, this one, the radiograph of the lumbar region of the vertebral column demonstrating the three intrapendicular needles, all of which have been placed into the middle of the vertebral body. So the high density uh, uh, material is radio opaque bone cement which has been injected as liquid to set solid. So it demonstrates okay a radiograph of the lumbar region. So radiopaque bone cement. Okay, so epiphyseal fracture. So epiphyseal fracture. There's stages of intense growth, typically around the ages of 7 to 10 years and later in puberty. So let me check in nutshell what epiphyseal fracture. So epiphyseal fracture is also called a Salter-Harris fracture. It's a fracture that involves the epiphyseal plate. Okay, That's a good one. Okay, so what's Salter Harris fracture? Joints. Okay, so I'll be dealing with joints later on. Okay, this is uh, skeletal system. Only the not the okay skeletal system. Just an introduction. Joints will be dealt with in another video, and also how to interpret medical images. So thank you.